Hey, this is Patsy with a Z, inviting you to join me every Tuesday and Thursday morning at 11 for Joy on Paper, a program that brings you the story behind the books you love. So listen in as I talk to best-selling authors about what inspired them and how they broke into the business. Have you written a book? Get advice from these best-selling authors every Tuesday and Thursday at 11 a.m. on Tampa Bay's Tan Talk Radio Network.
Hey, did you know there's a live psychology talk show 3 days a week, Monday, Thursday, and Friday at noon, where you can call in and get free guidance and also learn several different topics relating to ending the stigma of mental health? It's called Moments of Clarity on WTAN 1340 AM. It's with licensed therapist Tiffany Warner, who will try to end the stigma of mental health. But the only way you can do that is to listen to Moments of Clarity 3 days a week, Monday, Thursday, and Friday at noon on WTAN 1340 AM, the Tan Talk Radio Network.
Hi, this is Bob Cundiff. I'm running for Clearwater City Council. One important reason is that as I talk to residents of Clearwater, I sense that the residents feel that the City Council is not listening to them. As I see it, the Clearwater City Council works for the residents. We must be able to communicate to the Council, and the Council must listen. I'm for regular town hall meetings at all our libraries and better communication between the Council and Clearwater residents. This is Bob Cundiff, and I approve this message.
This is the Tan Talk Radio Network.
The Karen Rizzo Show on the Tan Talk Network. This is the show for seniors, caregivers, and their families. She is the author of the best-selling book, Aging in America, Navigating Our Healthcare System, which is available at Amazon, Nook, Kindle, and at agingguidebook1.com. Having worked over 20 years in the industry, she has the insider information about the healthcare system and how it works, and will help you navigate around the business side of aging in America. She also works as a patient advocate, consultant, and educator. Now here's your host, Karen Rizzo.
Good morning, Tampa Bay. Thank you for listening in. This is the show discussing navigating our healthcare system. The former show, Dan, set up some discussions very well for us today. One of the things that we try to convey to the listeners is how to be educated and empowered and know the honest truth on how our healthcare system works. Basically, since we are in such a for-profit system in regards to our healthcare system, the goal is that you know all of the programs and benefits available to you so that you're able to utilize them if you need them for a loved one, if you need them for yourself. So basically, it is based on the different chapters of the book. Today, though, we have a really, really good guest. Tina Costa has been a friend of mine for a long time. She's a registered nurse. She's basically a force in the home care industry. And she's here to be discussing different ways that caregivers can utilize home care. And as Dan had been talking about, all these things have certain costs to them, but there's a lot of differences that people don't understand. They think, I have Medicare, I'm taken care of. So, Tina, welcome to the show. Thank you for coming.
Hey, Karen. Thank you for having me. I'm excited to be here. It's been a while since I've done a radio interview, so this is cool.
It's fun. Yeah, exactly. One of the things that you and I have worked together for many years on and dealt with all kinds of different cases, and we find family after family that are so confused when it comes to needing some assistance at home. One of the shows, they were talking about how the hospitals, even the rehab centers, are now going to all this electronic health records. Mm-hmm. And then when somebody goes home, all that just stops. Like they get a pile of papers and there you go.
You know, that's a very good point. I never thought about it like that, but that's very true. Obviously the hospitals have requirements in terms of their documentation and for medical records. And yeah, when you come home, depending on the type of services that you have, it may be more electronic on the end of the agency, mm-hmm. but not what the patient or the client or the family is seeing from their perspective. It's folders with papers and
lots of papers
killing lots of trees on a regular basis.
Right.
But the electronic version of it is probably not as easily seen as they get in the hospital.
Exactly. Well, that's one of the things we're noticing a shift to, that even the assisted living communities by 2020 are going to have to be all digitalized with their electronic health records. So it's kind of big shift for our industry.
Correct.
But maybe I think you could clear up. Many people think, and there's a lot of home care agencies.
Really?
In Pinellas County.
How many, Karen?
Since we don't
5, 10?
I think since we don't have a certificate of need, I could open one tomorrow.
Yes, you could. But you wouldn't because you're my friend.
No, I wouldn't. No, actually, it's a really hard business as a professional to be in. It's a 24/7 business.
Yes, it is.
Because you're taking care of people whose needs might change in a second, in the middle of the night, on a holiday, on a weekend. It really, I always give hats off to anybody who's in the home care industry because it is a 24/7 business.
Right. And what I like to clarify with people when they say 24/7, it's not usually 24/7 emergency kind of thing, because in that case, that's where they're going to go. They're going to be directed to an emergency room. It's 24/7 in terms of so many things when you're dealing with at-home situation, when there's less controlled atmosphere, and you're dealing with people. And not only the people that are being cared for, but the people that are doing the care.
Right.
Life happens, and it causes some problems sometimes.
Well, and I think one of the biggest misconceptions is that people think, well, Medicare is going to cover everything. and I got Medicare. I'm good. I'm covered.
Good.
I got a supplement, and I'm taken care of for life. And I know Dan talked about the differences with long-term care insurance, and we'll get into a little bit more about that later. But maybe you can explain to people the differences between what Medicare home care covers and what Arcadia home care and staffing would cover.
Okay. I can touch on that lightly, and you may be able to, and I'm sure in your book it alludes to it a little bit more detail. But in my world, where it comes in terms of what I explain to folks when they call us, that believe that Medicare will provide the majority of the care, and I explain to them Medicare is more about short-term visits, and there has to be a physician's order for it. It has to be certified that they do require the care. And normally what happens is if you're in the hospital and you're discharged with either you've had a new diagnosis or an acute exacerbation of an existing problem, change of medications, whatever it is, the physician can write for a Medicare home health evaluation. Now with that, you can get a nurse coming out to the house, you can get a therapist coming out to the house to do, physical therapy, occupational therapy, speech therapy, you can get a social worker coming out there. Medicare will cover all of that. If you're getting those services, the physician can also write for a couple of bath visits a week.
Right.
And Medicare will pay for that as well. And that's, 45 minutes, an hour of a certified nursing assistant or a home health aide coming out and providing basic hygiene, personal care, bathing, grooming, dressing, that kind of thing. If you need any more than that, Medicare does not cover it.
Right. And I've actually seen a shift with some of the Medicare agencies where they're not necessarily even employing CNAs anymore.
Correct. We actually have partnerships with several Medicare agencies out there, and the partnership is twofold. It can be either to provide that extra private duty care that they need, but also to help provide home health aides and CNAs for their bath visits because and it used to be automatically when you got Medicare home health, you automatically got bath visits. Now the physician has to write for that. And a lot of them just don't have the availability, so we are able to help them in that regard.
Yeah, and that's really a great service because that helps to preserve somebody's dignity. And I've seen patients come out of hospitals that haven't been showered in weeks or days, and it's really bad.
Yeah, it can be smell bad, look bad, feel bad. If you feel good, you're going to heal quicker. But the other piece of it is a lot of times while family members and friends, people from their church, whatever, can get in there and help with meals and maybe help with some laundry and some cleaning, some basic activities of daily living. But when you're talking about a son or a daughter or a granddaughter, a niece, a nephew, cleaning mom and dad or grandma in such an intimate way, it's very uncomfortable.
Yeah, and I can see where that would be a definite need. A lot of people have this idea that if they're calling in home care, like you said, it has to be 24/7.
Right.
What's usually the average situation for most of your clients?
It's probably different from one agency to the next, but I would feel safe in saying what our average is, and it's very different than what my average private duty case was when I was in this industry 15 years ago. 15 years ago, it was 8 hours a day, 7 days a week, at least. That was the average case. Nowadays, with family, friends, people that they play bingo with, support systems are different now, and they're better, which is a good thing. But I would say probably our average case is 3 to 4 hours a day, 2 to 3 days a week. And that's not a lot.
No.
It really isn't. But private duty is more of, from what I see, it's like a hole filler.
Right.
We get in there and where family can't be or a friend can't be or someone just needs a break, that's us going in there. So it's not this big, massive commitment that you have to take out a second mortgage on your house to provide that care and give son or daughter or granddaughter or niece or nephew or mother, whatever it is, a break.
Yeah, and respite is something that a lot of people don't learn until after a loved one has passed on. But it basically is just a word that means it's a break. It's a relief. And respite, utilizing Medicare home care, which, by the way, if you go to your doctor, and if you're taking care, if you're a full-time caregiver and you have seen any unsteady walking, a slowdown, a change in medicine, a fall, those are all good reasons to call the doctor and get an order for Medicare home care, because it used to be you had to fall and break something and then you could get home care. Right. Now,
now we're trying to prevent that fall from happening.
Exactly. The whole goal is a big fall prevention to keep people out of the hospitals. So they are ordering it preventatively. Now, if you are at your wit's end, and I've heard from adult sons and daughters that, like, oh my goodness, mom's asked me the same question 15 times. She doesn't realize it. I'm going crazy. I need to get out. Definitely utilize a private duty home care agency, because sometimes at 3 or 4 hours, it's not just a break for the caregiver. I've seen patients that go, thank God someone else is taking care of me. I need a break from her.
Well, what I think what it comes down to is, we all love our families, or at least we hope that that's what it is. But, maybe a daughter just needs to be a daughter for a little while rather than the caregiver.
Right.
And not have to worry about someone coming in and doing the personal care for mom and doing the laundry and doing the cooking and the cleaning and making sure she's taking her meds, but just to come in and have a light conversation with her, or on the other end of it, to be able to get out of that environment, maybe go see a movie, go shopping, and know that the caregiver's there and they feel safe at that point.
Well, and maybe since there are so many home care agencies and people get confused, maybe you can discuss the different business models of home care agencies for our listeners.
Okay. Well, and I think probably one of the biggest misconceptions is that it's unaffordable, that it's a luxury, and it's, I like to say that it's just like anything else, supply and demand. It works in any industry, doesn't regardless of what it is. So it is not unaffordable. But there are different types of home care agencies out there. There are companies that we call registries, which primarily, employ, or don't even employ, but use independent contractors. So they are what we call registries, or they're also referred to as nurse registries. But they're not just nurses. They're CNAs, they're home health aides, they're companions that are not an employee of the agency. They are 1099s. They're independent contractors. So while there's some legal ramifications with regard to that, some of it, the first thing that the John Q. public is going to see is a financial ramification. Because they're not employees, there's less overhead. Right. There's no supervision or monitoring. And that's by law, because you cannot supervise, monitor, give direction to someone that is not an employee of yours. So the agency is just that. They're like a third-party administrator. They are identifying clients, and once someone comes on board, they are then contacting their independent contractors, who are their people, their caregivers, whatever they may be, and then connecting them together.
So they're almost like a referral agency for assisted living communities.
Yes, exactly. And it's not that they aren't good at what they do, and they are licensed. They're licensed as a registry. They're just not licensed as a home care agency. It is very important with companies like that to find out exactly what credentialing they have, what their screening requirements are, what their coverage is in terms of licensed, bonded, insured. Some of them are licensed and bonded, but they may not be insured. So if an independent contractor, just like if you hire a plumber, a contractor to come out to your house, you need to make sure that they're covered from a liability perspective, workers' comp, and if they're injured, or the person they're caring for is injured, if something gets broken in the house, something goes missing, not that ever happens, but that there's accountability for that, right. And there's someone to go to make it right, regardless of the situation. But again, like I said, the biggest differentiator is like when someone calls us, and if their primary concern is finances, if they're not interested in anything else that goes into deciding which agency they're going to work with, if it's just about the money, then I'm usually very upfront with them and explain to them there is a cost difference. It's not just because we think we're $4 better an hour. It's because we're a different business model.
Because the agencies actually do the level 2 background screens.
Correct.
And then
Correct.
what are the other screening things?
All agencies, whether they're registry or not, are required by law to do fingerprint background check through a national database, through the FBI. Required to do it and doing it are very different things.
Yes.
And we just find that out because, and I'm sure other agencies experience it as well, when someone comes to apply for work with us and they're actively working for other agencies, there should be one on them in the system. You can go on to the Agency for Healthcare Administration website and you can look it up.
Right.
If they didn't have one and they're actively working, that means that they were actively working without one. So that is required by law, whether you're a licensed home health agency or a registry. Anybody that comes in contact with seniors like that has to have a fingerprint. But there are less restrictions, less regulations, less compliance with regard to registry. So in there, any business person knows the less overhead you have, the less your expenses are, and that gets passed on to the consumer. And if they have to pay less to be in business, they're going to charge less. So if you look at a registry versus a fully licensed, accredited home care agency like Arcadia, the span of difference in cost could be anywhere from, for us, maybe 18 or 19 an hour, and for them, maybe 14 or 15.
Right.
An hour. So that's a pretty significant difference. And then when you look at hiring a private caregiver without going through any sort of agency, you're looking at, anywhere from $12 to $13.
Well, and when I've seen horror stories from the private caregivers, so I always say shop around and danger, 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 run. If it's necessarily just someone who's butting up to mom or dad or grandma or grandpa, because sometimes they smell the money there, and it's I've seen people work themselves into the will. I've seen them become a power of attorney.
Oh yeah, absolutely.
Really, really scary situations. So we're going to take a quick break. When we get back from the break, maybe you can discuss a little more on how some of the programs out there to pay for home care.
Okay, perfect.
This is the Tan Talk Radio Network.
Are you caring for a loved one who needs more time and attention than you have to give? Arcadia Home Care and Staffing provides specially trained companions who provide personal care with an extra measure of warmth and professionalism so those you care about can have their needs met right at home. Keeping your loved ones in familiar surroundings can make a world of difference in their quality of life. Call Arcadia today, the Quality Home Care Service. All Arcadia caregivers are background checked, bonded, and insured. In Pinellas or Pasco, call 727-579-9414. Other areas, call 813-306-0007.
Listen, do you hear that? It's the sound of your senior care community's IT systems running smoothly. In this time of ever-changing regulations and requirements to share electronic health information, that's not easy to achieve. After all, you're in the business of taking care of people, not computers. Let the team at QShift, Inc. put our 30 years of healthcare IT experience to work for you. Think of us as ever-vigilant partners working to manage your electronic health records, IT planning, network security, systems integration, and IT training needs. With affordable solutions for skilled nursing, assisted living, and continuing care communities, the QShift team has the services for you. Why QShift? Because we're there for you every shift, every day. So go to qshift.com, that's QUESHIFT.com, or call Rick at 717-428-9020 to learn more.
This is the Tan Talk Radio Network.
Good morning, Tampa Bay. Thank you for listening to the Karen Rizzo Show. We're discussing with Tina Costa from Arcadia Home Care and Staffing the different types of home care that is available. The big push for those that are kind of new to the healthcare world is that the industry is really trying to employ more creative and outpatient modalities to keep people out of the hospitals. Home care is becoming a big player in this movement. In this shift, years and years ago, people went to the hospital, they went to a nursing home, and that was it.
Yep.
But now, Tina, I'm finding out every week about a new program, a new benefit, a new system that's being designed and developed to keep people home, and especially for the people that are falling through the cracks. So I know you were discussing the rates before the break, but
Right.
how do maybe you can discuss some of these different programs that people might not be aware of are out there.
As usual, nothing is really free
Right.
anymore, worth having anyway. So, but, private duty home care is not all about writing a check from your personal savings account or whatever it may be. While sometimes that may be necessary, there are other avenues out there that a lot of people just don't know they exist. And so many families come to us and they're like, if I had known when, if I
Right.
had known about this when, right down to, I think the previous guest on the previous show was talking about long-term care insurance, that even so many people we see that they have it and they don't use it.
Right.
Until they just want to wait till the very last minute and they've paid all this money in and then they've only used a small chunk of it. But in addition to privately paying for private duty home care, there are VA benefits, which is huge. I mean,
Yeah.
yes, you have to qualify, you have to be a veteran, all that good stuff. But underneath the veteran umbrella, there's multiple programs. It's not just your basic pension that veterans get if they're, honorably discharged and all that good stuff, which, gives them access to physicians and health care and medication and all that. That's the basic pension. But then under that, there's several programs that exist depending on what their need is.
Yeah, and I try to refer to veterans as retired military. I do that for their spouses because I've talked to groups full of seniors, and remember World War I, World War II, Korea, those were mandatory drafts, and you can have a group full of people and say, who here is a veteran? And maybe get one or two, guys that raise their hand. And then you say, who here was ever married to somebody in the military? Who here is considered retired military? And then all of a sudden half the women
raise their hand.
Because they don't count themselves sometimes as veterans.
That's true. That's a very good point because a lot of them have been married to a
Correct.
veteran, and that's the other key piece to it. Just because, spouse has passed,
right,
does not mean that you're not entitled.
So
to some of those
I always
benefits.
tell adult children, ask the question: was dad in the military?
Yep.
Did he serve? Was he honorably discharged? Because that means mom is eligible potentially for one of the multiple different veteran programs that are out there.
Correct.
So,
And even if they're, because there's limits to what they can have in terms of assets and income and all that. But even if they're a little over, not a lot over, but they're a little over, it doesn't mean they won't get the benefit. It just means they might get less of a benefit. So it's almost like not asking the questions is unfortunate. And, obviously the government winds up saving that money because they're not having to disperse it out to people that need it. But with the VA, the way it works is the aid and attendance program is probably something that has gotten more and more attention and recognition, I would say.
Finally,
yes. I mean, I've been with Arcadia 7 years, and it was only probably 4 years ago or I started I didn't know about it either, but really hearing about it.
Oh, you read my book?
Yeah. That and talked to a few people here and there, but realized it's almost like one of, to use a cliche, one of the best kept secrets that the VA has.
It definitely is.
But in addition to the pension, they've got their regular community home-based program too that they have, and we're a contractor for the VA, so we do a lot of their other clients that are on the basic pension, but then they get home care benefits as well. You can also get the aid and attendance program on top of that. So,
and a lot of people don't realize that this aid and attendance is just extra money. It ranges from approximately $800 a month to over $2,100 a month, depending on a numerous amount of situations and issues.
Correct.
If you have over $80,000 in assets, I always recommend that you go to an elder law attorney that's veteran certified and has that training.
Correct.
To help get you those benefits. But if not, Pinellas County offers the veteran service officers at no charge that can sit with families if they're under that asset amount.
Correct.
And decide which and what programs might be eligible. And, the good thing about enrolling in them is that you might not need them today. But if mom or dad or if you know somebody who's been diagnosed with a chronic illness, go get yourself set up. Because
you're going to need care.
You're going to need it at some point. I mean, you know, I always try to liken it. There was a study that came out that for those that are over 65, 75% of that age group are going to need long-term care. It might be home care, it might be assisted living, it might be skilled nursing. And I always try to tell some of our senior or older population, if you had a CD that was going to get you a 75% return on your investment, oh my goodness, how many of them would you have? You'd be putting all your money in that.
Yep.
So
That's true.
it's worth it to get yourself prepared with those odds against you.
Right. But I will tell you the biggest, the most infamous catch-22 in healthcare nowadays is the VA aid and attendance program, because in order to get it, you have to be receiving care. So the program that I wanted to mention is called Vet at Home.
Okay, yeah, that's
new. It
new.
is a new partnership that that Arcadia went into December. End of December was when we officially signed the contract. So I've been out there trying to promote it where I can. The way it works is the quote-unquote perfect potential client for this program is someone who truly does not have the money. They come within the limits of what they can have in terms of assets and income. They really need the care. They don't have the money to pay for it. So it is not the folks that are over on any of those things and that need to have an attorney involved to help them to shelter assets or create trusts. It's not for that. It's for those folks that truly need it, which we all know they exist, and don't have the money because you have to be paying for the care in order to get it. So it's nice to plan ahead.
Right.
But for the aid and attendance piece, the VA has to see that you're getting the care in order to justify the fact that they're going to award you the money based on that.
So basically, this is for our low-income veterans and spouses.
Correct.
And those who potentially have very low savings or no savings.
Correct.
And actually need showering, bathing,
right.
medication management,
laundry, housekeeping, any of those basic things that for whatever reason they might not be able to do. Now, I will tell you, we had a gentleman call us a couple of weeks ago about it, and it turned out he was on 100% disability. Okay. So when you compare what he was getting versus doing the aid and attendance program, he was better off to keep what he had. And that's fine. It's almost like you have nothing to lose by looking into this program, because the worst case scenario is we're just going to say we can't help you.
Right.
But the way it works is if the right client comes along, they meet the criteria and the eligibility, what happens is, because the aid and attendance benefit can take a little while to come through. You know, you don't apply and next
it's like
week
4
you
to
get
6 months if you're lucky.
Correct. The way it works is Vet at Home partnered with Home Care Financial Services, and what they do is they pay us to go in there and provide care until the aid and attendance benefit is secured.
Nice.
And I've had several people ask me, okay, well, what if Vet at Home made a mistake and the eligibility isn't appropriate and their benefit doesn't come through? Are they going to get hit with a bill? No, that's not the way it works. That's an arrangement between us and Home Care Financial Services. So ideally, they'll do their due diligence and make sure that it's a good claim before they do it, because they're going to be putting out that money to pay us. Obviously, we're paying a fee in order to be part of it, but the winner is the client. Is the veteran or the spouse of a veteran, because they're going to get that care without having to put anything out of pocket. Now, I will tell you, for someone that is looking at this as a temporary measure, like we were talking about assisted living versus skilled nursing, long-term care, if this is someone who is not planning on being home for at least 6 months, it's probably not the plan for you. And the only reason I say that is because it's not that you can't get enrolled, it's that in order for it to make sense for us as a company to take on that risk is at least 6 months worth of care.
Okay, so 6 months or more is really kind of where you're...
A sweet spot is what I like to call it, and someone that doesn't have the money to afford the services.
Right. So this isn't somebody who's spending 60 days in a nursing home so they can qualify for assisted living.
No, definitely not. Or someone that's, at home but has declined so rapidly that they need to go into skilled nursing in the next 3 months. That's not what this is for. And the money does, just so people understand, it is set up in an escrow account for the veteran or the spouse. It's not something we touch. It's not something Home Care Financial Services touch, but the money does have to be used for health care, for those services, that kind of thing.
Yeah, that's a new program. So this is, it's worth a phone call. Where would they call to find out?
A couple of things. They can do 2 things. They can call Arcadia directly, and what I'm telling people to do is just call me, call my cell phone. I know the most about the program. The internal office has been brought up to speed, but I feel like for this, because I've learned so much doing the presentations, I'd rather have them talk to me first.
Makes sense.
And I'm going to give my cell phone number because I have no problem doing that. It's all over the place. And
that's true.
On my cards anyway. But it's 813-334-3472. And or they can call Vet at Home directly and just tell them that they heard about the program through Arcadia Home Care.
Okay.
And Vet at Home's number, I'm going to give that to you right now, is 844-484-8373. 8387. You can also check them out at www.vetathome.org. And what's great is it tells you on the website during what approved war periods are acceptable. And I think as we, I think that's the biggest obstacle, or the thing that people don't know is, okay, what is the approved wartime, so they can see if they fall. The way it works is, in terms of their service,
service
has to be at least 90 days of active duty, period.
Right.
They cannot have been dishonorably discharged.
Of course.
And one of those 90 days has to fall between one of these 4 periods of eligibility for war times. The only one, there is one on here where they actually had to be in country, and which is boots on the ground, is in one of the Vietnam time frames.
And we had to fight for that,
Yes.
even to get changed.
Very much so.
For a long time, Vietnam was classified as an occupation.
It wasn't a war.
It wasn't considered a war, so we had to, as an industry, we had to fight really hard to get that changed so that our Vietnam service officers were able to get the benefits that they were entitled to.
Correct.
And we know they came back with a lot of problems. So maybe you can discuss a little bit. A lot of people don't understand the differences between Medicare and Medicaid, so I'm going to be a little facetious here. Medicare is the federal program, and I always tell people to think of it as that's the one that the government provides because supposedly they care, and and then the Medicaid is a state aid program.
Correct.
That each state decides independently of what programs that they are going to fund and utilize and partner and figure out how to pay for. So maybe you can discuss Florida's Medicaid programs, because we've gone through a big shift in the last 2 years.
Well, and I won't cross into an area that I don't feel comfortable with. My experience with it is how it relates to the private duty piece of home care, and Arcadia is a contracted provider for all 4 of the long-term Medicaid managed care programs, which is Molina, Sunshine State, United Healthcare, which is now Optum, and American Elder Care, which is now Humana, soon to be Aetna.
That's new.
Yeah,
oh, great.
Exactly.
Another one.
So it's interesting because there used to be a whole lot of specific Medicaid programs that you would apply, get credentialed to be a provider for. Now it's all one big bucket.
Well, they call it
Medicaid dollars.
The technical term for it is long-term care. Medicaid, under Medicaid. It used to be called diversion. It's gone through a lot of name changes, and it's evolved quite a bit, but it now covers private duty as well as assisted living.
Correct.
Used to be it only covered assisted living, so we're grateful that it now offers home care, because there's a lot of people out there that really struggle with their activities of daily living, and that can be either a temporary or a permanent fix sometimes until families come down and they make some decisions. They decide, where is going to be the best place for mom or dad. Maybe there's a daughter up north that is, has time on her hands and can actually help, or maybe there's, with families being displaced all over the country. I'm grateful that here in Florida we have the programs, but we know sometimes, like you said, they're just a Band-Aid, or they're just a stopgap measure until some difficult things can be decided.
Right. Well, when you look at assisted living and the long-term Medicaid managed care programs that are out there, it does pay for in some assisted living, but not all of them accept that as a payer.
Correct.
But also, it may not cover the whole cost.
Correct.
Of the assisted living. So then
it's
a chunk.
They only pay $1,100 or $1,200 a month. Most assisted living communities start, the bare bones ones start about $2,000 a month and then go up from there. So you're really not going to, that Medicaid doesn't usually cover the full cost of assisted living.
Right.
Where the difference with home care is that I haven't known any Medicaid recipients to have to pay out of pocket if they are receiving home care. Have you?
Well, we do have some that do that. We have some that are getting, that are on board with one of the 4 providers that I mentioned to you.
Okay.
But they need more, and families willing to help. So they will pay privately for, not them because they don't have the funds, but a family member will pay a little bit to kind of help supplement some of the care.
But at least it helps with some of the cost of it, because like you said, $19.20 an hour, that can add up quick.
It can add up. And again, that's why, when people call me and I try to find out their situation, because I get it. Sometimes it's not that, for example, if you had a choice to go to, Shula's to get a steak or McDonald's to get a cheeseburger, you're going to choose Shula's.
Right.
But financially, you may only have the money
Money
to
for
pay
McDonald's.
for McDonald's. So when right, exactly. So when people call me and they're like, we would love to have a company with all the bells and whistles, everything that you're talking about, Tina, but we have this much money
Right.
to spend. How can you help us?
Right.
And that's where it comes down to. So I will tell you, being in the community for as long as I have, I don't know everything by any means. I would never claim that, but I know a lot of people. So I will
Right.
never tell someone, I'm sorry, we can't help you. Good luck and goodbye.
Right.
I will try to connect them with someone that can. The only thing we aren't able to do, liability purposes, is refer someone to a private caregiver just because of the liability that goes along
Well,
with that.
and again, we were getting into that a little bit. People don't understand that when they hire a private caregiver from church, from a neighbor, school kid, whoever they're hiring, that they are now the employer of that caregiver. So all the duties and responsibilities of an employer are now on you.
Yep, that means Social Security, taxes, workers' comp, injury, all of that kind of stuff. And a lot of people don't realize that. And even when they do, sometimes again, and for me, it's not about saying one is good or bad.
Right.
It's about saying this one does this, and here are the risks.
Right.
This one does this, and here are the risks. And then you decide what you want to do.
And I would urge strongly that if you are hiring an agency and mom or dad are alone by themselves here in Florida or even another state, you need to be very, very careful, because if you don't have a lot of eyes on the situation, you are taking an enormous risk if you're just hiring somebody off the street. I
Correct.
mean, seriously, it is. I have heard of stories where neighbors have come in with keys to their neighbors' houses and
Cleaned them out.
Cleaned them out. I had a case that we worked on where the gentleman was declared incapacitated, admitted into a nursing home. The neighbor, the guardian, professional guardian, and myself caught the neighbor sitting in the living room counting the cash.
Oh, jeez.
Literally counting the cash, and then wanted to know where her copy of the key was going to be.
Okay. Well, that one wasn't a real smart one either. Then,
No.
apparently.
No, we were, and the reason the guardian wanted me with her was to have a witness to whatever the belongings were of the gentleman. So again, you get into such high risks when you're dealing with people that are alone and vulnerable. It is definitely not something to think, oh, it's no problem, I'll just go on the internet and whoever's ranking the highest, I'll just grab it.
Right. Well, as a plain devil's advocate or a caveat
Right.
to that, Karen, is the best way to get a referral, probably in many, many industries, is word of mouth.
Yes.
Someone that used someone and had a
Right.
great experience with them.
Right.
Not maybe the company, but that, that person did a phenomenal job for them. And if you
Right.
can get that person to then work with you, you're 10 steps ahead of the game already.
And I can give a personal testimonial that I had worked with your office, and one time you weren't even working that day. You were out of commission. You were not feeling well, and your office had a really outstanding caregiver for a client of mine bedside at the hospital within 2 hours. I couldn't even believe it, and it gave the wife the chance to go home. She didn't drive at night. Know that her husband was in good hands.
Yep. And a lot of times that's what we do too. People think of private duty as only in the home. We go everywhere. We go
Right.
wherever they call home. So in that situation,
Right.
she wanted someone to be with him.
No, I was insisting.
Okay, you were insisting, and you called me, and we got it done. Now, does that mean that happens every time? Maybe not.
No,
but
it
we
was a
try
very
our
rare
best to
situation.
do that.
But it spoke to the professionalism, because the CNA called me, gave me a full report in the
Nice.
morning. Also called me when she arrived just to let me know. I notified the unit manager on the floor to let them know that your staff was coming in. And they were just extremely professional. And even the staff at the hospital had said the same thing, that
Thank
they
you.
were very professional. She knew what she was doing, dressed appropriately. People don't understand that sometimes, caregivers show up with these long nails, and, a senior skin can be very delicate. It could tear easily. There's a lot of things that you don't.
Well, and sometimes their dress isn't appropriate,
Right.
or their makeup or hair, or they have jewelry in certain areas that you wouldn't want. I mean, we forget sometimes we're dealing with older folks. We're
Right.
dealing with elders that don't look too highly on that kind of thing. And
No.
one thing I do want to say real quick, if we have
Sure,
time,
we have
Karen.
time.
Okay. Regarding, because what we don't ever want to do, if we can avoid it, is if there's someone who does have a friend
Right.
or a neighbor or someone from their church or their bingo club that has been doing a fabulous job with what they're able to do.
Right.
Without training, without certifications.
Oh, there's
without
natural-born
education.
caregivers out there.
Absolutely.
They do a great job.
And we don't want to take them out of the scenario because
Right.
that's what's going to help that person to feel
Right.
better about the whole situation. But we can complement that. We do have several right now that we take care of, that we are the overseer of it. We may send someone in once a week, once a month, just to make sure that everything that this private caregiver
Right.
is saying that they're doing, because there isn't any other family local, is actually happening. So we can be those eyes and ears from a compliance regulation
and that's a
perspective.
very affordable peace of mind.
Absolutely.
Especially if, we talk about the sandwich generation and how the habits are, talk to mom or dad on Sunday.
Everything's good.
Everything's good. No problems. And it is nice to have that extra set of eyes so if they've had a fall, if they've had a bad report at the hospital, if there's some changes going on, if they're forgetful a little bit more.
Well, and if those changes are happening and nobody is doing anything about it, it may be due no fault of their own that they just don't have that training and knowledge to know, okay, this is a problem, we need to do something.
Right.
When they're on service, the nice thing with a company like Arcadia is they automatically get supervisory visits by a nurse.
Yeah.
Every 30, 60, 90 days. That is part of the treatment plan. There is no charge for that.
And I don't think a lot of people realize that home care agencies also go through annual surveys.
Correct.
By the state.
Well, and the nice thing is, I guess, like I said, it's not necessarily annual anymore.
Okay.
It's kind of every 2 years, every 3 years. And if they're accredited like we are, it's even less frequent because you're following more stringent guidelines to do that.
And
So,
that
yeah.
accreditation's the JACO standing.
Yes, JACO. Ours happens to be ACHC, which is another similar regard to that, because where our corporate office is in Southfield, Michigan, was the first place that we got accredited. And Florida, all of our offices were accredited at the same time in 2013, I believe it was.
Okay, so the main thing is that, you're going to get what you pay for kind of situation here.
Pretty much.
But definitely if you're listening and you, mom or dad served in the military, it's worth a phone call to find out about the new Vet at Home program. That's a new one.
Yep.
There's going to be a lot of interested people in that
Well, I would hope
program.
so. And like I said, they have nothing to lose by calling. I can usually, in a few questions on the phone, give them an idea if it's something that's going to work for them. And we do provide a free initial consultation. There is no charge for anything that we do. Another big thing that we offer that is huge in terms of maintaining independence and control is asking and allowing our clients to interview caregivers ahead of time so they know who's going to show up at their house.
Yeah, that's a huge thing. And I think a lot of families forget that when somebody's coming home from a hospital or a rehab center and they've had an extended time away from the home, that there's a lot of, there's spoiled milk. There's a lot that needs to be done. There's prescriptions that need to be filled. Does your agency offer a program for something like that?
It's not a specific package in terms of cost-wise, because it's basically
the same cost.
Case by case, yes, same cost, but also curtailed to exactly what their needs are. But since we don't have a minimum and we don't have any sort of contract or obligation, it's a pay-as-you-go thing. So we can go in there for a few hours just to get them home and settled, make sure they have food, make sure the meds are picked up, make sure they have clean sheets, that kind of stuff. Easily we can do that.
Yeah, and that's a big deal because again, people don't realize that Medicare, even if a doctor's ordered Medicare, when they go home, the start date doesn't usually occur till the next day. If you're lucky, sometimes it'll be the following. And I always have laughed to myself how we call it Friday dump day, where Fridays, that's when all the patients were getting discharged.
I got a few of those calls this past Friday, Karen.
Yeah, it's. I mean, we were all always working till 7 or 8 o'clock at night, everybody, but that's the day when everyone's going to a rehab center, everyone's going home all of a sudden. And then for home care, Medicare home care agencies, a lot of times they don't do a start of care till the following Monday.
Well, they have, I believe, and I could be wrong, it's something like 48 to 72 hours to actually do the admission. The assessment.
Okay, the initial intake.
Yep.
And that can that's a long period of time for somebody who's just gotten over a surgery, an illness. They're under a new medication regime.
Which is why those partnerships you were alluding to before, I work with a number of Medicare home health agencies, and it's a good partnership because we also refer back. We aren't Medicare.
Right.
So if our existing clients need help or people call us and they think we're Medicare certified, then we can refer to our partners. But it works well for the partnership in terms of, because any Medicare agency out there knows that once they get somebody home, it is critical, if possible, to keep them there, because you don't want them going back to the rehab, back to the hospital, back to the nursing home.
Well, and now finally the hospitals and the doctors are much more committed to this partnership because financially they're not getting reimbursed as they used to.
Yeah,
if there's a
money's
30-day...
a good motivator, isn't it?
It's funny. Well, if we're going to keep a for-profit healthcare system that's driven by money, the only way that reform happens is by financially penalizing the organizations.
Well, get them where it hurts. That's their pocketbook.
It's the only thing that created the Medicaid possibility to expand into providing home care and assisted living. For the longest times, the state was paying and going bankrupt, paying for all these people living in nursing homes that didn't need to be there, quite frankly. And, in Pinellas County, we have over 5,000 nursing home beds.
Wow.
That's all we built. For 20, 30 years ago, we built homes and we built nursing homes. That was all we built. And so that was all that was there. So now they're still there. But again, you have to shop around. You got to look at things. The main thing that is exciting about the role home care is taking, finally, from my perspective, is that people get more choices. Mm-hmm. They want to stay home. They're comfortable at home, but homes can turn into death traps.
Yes, they can. That's an interesting way to put it, Karen, death traps. I will say that it's, while that is the ultimate goal for some people, usually the thing that is the deciding factor is finances. Right. Is usually what does it, because keeping someone at home 24 hours a day, 7 days a week is not cheap.
Right.
And for some people, they can do it temporarily. It's for a brief period of time.
Or they would need to have had a long-term care policy that they were buying into for a long time.
Exactly. That can help supplement that.
Right.
So while people may want to be at home, our job as well, even though that's our business, our job is to not allow them to be at home if it's no longer safe. For them to be there. And that's key. So I also have partnerships with assisted living communities because while, from a business perspective, we do home care. But you know what? We provide home care in assisted living as well. Right. So the ultimate goal is, and hopefully any agency that somebody's working with out there, that's their goal, is where is the client not only going to be happy, but thrive and be safe. And that may not be at home.
Well, and sometimes the happiness factor isn't going to be there. I mean, the truth is that when they say it takes a village to raise a senior, it's not necessarily always because sometimes they're unaware of how much care they require. Sometimes it falls on the adult children or the other providers, such as physicians and home care agencies and the professionals, to kind of help them be safe.
Correct. Because they don't know enough to know what to ask.
Well, and especially because right now, we're seeing a higher percentage of dementia than we ever did years ago. And stage 1, stage 2 dementia, man, people are good at hiding that stuff. They don't necessarily let on that their memory is slipping. And I mean, we went through this with my own grandmother, so it's from personal experience and professional experience. Sometimes the happiness factor might not be there, and that's okay. I've told families for years, if they're like, oh my goodness, we've tried home care, it's not working, they need more than we can afford, how do we get them into assisted living? And I cover that, a whole chapter of tips and tricks in my book on...
Yeah, we call it therapeutic fibbing, right?
Yeah. Well, this is what I've noticed consistently. Every time someone's been in a house for a long period of time and they're needing to make that change, there's almost always going to be a roof that needs repair, a bathroom, a kitchen that needs updating, a house that needs tenting, some kind of major renovation to that home that needs to occur.
Right.
And sometimes that can be a good motivator, or using a respite stay at an assisted living community to get them comfortable.
A trial. See what it's like. Absolutely.
And it's up on, and it really falls on all of us as a community to make sure that people are safe, they're getting what they need, and they're educated about all these different programs, because I've seen families struggle and chip in $5, $50, $100 here and there to keep mom or dad home, or to keep whatever situation that they have working. I mean, recently I had a realtor that installed cameras in his mom's place because she said she was not falling, and then he wanted to know if she was falling.
She was falling, okay.
So there were nanny cams everywhere. And that was how he was trying to determine actually what her needs were.
Wow.
Retired nurse, so don't knock it. You being a nurse, you know.
Oh, are you serious, Karen? No one's going to want me in their building.
No, we're the worst patients out there. But it is something that a lot of families struggle to see and do, and sometimes they don't even know. I mean, I worked with a client who worked for the Pentagon. It took him 10 months to find out that his mother was eligible for aid and attendance to stay at home.
Oh my God.
Now, they were a wealthy family, but in the meantime, they had gone through thousands and thousands of dollars with home care for her because she couldn't be driving anymore. She was having vertigo and falling and needing to have that safety assistance. And he's, and he worked for the government.
Yeah.
I mean, I casually asked him, so what do you do for the government? And he said, classified. I was like, okay.
If I tell you, I'm going to have to kill you, Karen.
Right. So it basically was one of those situations that it really enforced in my mind how much the education piece is needed out there because people are living longer. It used to be, my grandfather died at 68 years old. It used to be people lived in their 60s, 70s, maybe. So there's no class and there's not a lot of support groups are great for people that when they're struggling with Alzheimer's and dementia or Parkinson's or one of those big illnesses, but most people find out after the fact.
Well, and I will tell you, and because you can relate, because I know we're on a couple of these groups together, there is information out there.
Yes.
There are free seminars.
Yep.
Everywhere, and providing multiple pieces of information from attorneys to financial advisors to insurance to caregivers to realtors to,
everything.
Giving away this information for free. Getting people to attend is so tough, but yet then when you meet them, they're like, God, I wish I had known. And I'm like, God, I wish you'd come to one of our 10 seminars that we did, Right.
Well, and that's the thing. If you guys are ever interested, look up online basisfl.info. is one website. It's the Bay Area Senior Education Services. There's going to be an ice cream social in March. You can always find information out on my website, which has all the community events, agingguidebook1.com. If you look under community events, you can always look and see what's happening. These are free things. You don't have to pay for them.
Nope. And there's usually some sort of snack,
door
prize,
or both, or something to give away. But more importantly, you'll have time to sit with people who've worked in these programs in this industry for so long that if you're struggling, you don't have to struggle in silence. And nobody puts anyone on the spot. A lot of times we'll ask the group, is there any questions? And there's crickets. And then afterwards they swarm you because they don't want to discuss their certain situation. And respectfully, all healthcare professionals respect that privacy and that dignity factor. It's something that we get surveyed on, regardless of our entity. The dignity factor for patients is a big one. So if you're interested, we discussed a lot of programs today. We discussed Vet at Home.
Yep.
If you're interested, you can always call Tina on her cell phone. What's the cell phone again?
813-334-3472. Now, that's a Tampa number, obviously, because that's where I live. But I cover over in our St. Petersburg office, which is responsible for all of Pinellas and all of Pasco County.
Okay, and it's a new program. If it's just gotten finalized in December, everyone's going to have to learn about it as we go. So that's a great program. If you're interested in getting a copy of my book on aging in America, and you don't have access to the internet, I still get some notes through the snail mail. You can send a $19 check to Elite Marketing at P.O. Box 7221, Seminole, Florida 33775. And if you have access to Amazon, it's there. It's on Kindle. It's also downloadable on Nook. Or you can also message me through my email, which is agingguidebook1.com. Also, my cell phone's there. If I know a lot of people sometimes have called afterwards, after the shows, and they had questions, you can always contact me at 727-452-1300. I maintain that there are really no stupid questions.
No, there definitely aren't. There's just people that don't ask questions that they should.
Exactly.
That's what there is. And let me provide, just in case somebody, in terms of the other services that we offer, you can also call my cell phone. But the office number in St. Pete is 727-579-9414. And feel free to visit Arcadia's website as well. There's our national website, and then each office has their own individual website. So you can go to www.arcadia.org shop.arcadiahomecare.com and find any location that way.
Okay, and remember, folks, that this show has really helped to help people as we age, and we're all aging, to do so healthy, wealthy, and wisely. Thank you very much.
Thanks.